Hello everyone, welcome back, and thanks for listening to another episode. Today we will be talking about depression, and this is going to be probably the first of many episodes on depression because there's so much to talk about. So many people struggle with this disorder. I've struggled with this disorder. In fact, it was what brought me to psychology in the first place. So we are going to kind of go over what it is. I'll talk a little bit about my own story. And then we have a guest, Dr. Tim Strauman, who's the director of clinical training at Duke and an expert in depression. So he'll tell us about how we can help our friends who are struggling and what kind of treatments to look for. And we thought this was an important episode to talk about fairly early on, and especially as COVID rages on, because we are hearing from our friends, from our patients, that depression is something they're really struggling with right now in particular. If for no other reason, there are so many things that bring us joy that we're used to getting joy from that are not available to us right now. It's so hard to see our friends, so hard to socialize. Loneliness is increasing. We are not able to go out and do the things that we're used to doing that we love. And so we're seeing a lot of lack of motivation, kind of apathy, sort of low mood, just sort of a general sluggishness. And so, Kibby, do you want to tell us what depression is?
Yeah, I think it's important to at least know what clinical forms of depression look like, because the word depression, or I feel depressed, is just so common now, right? Like we just throw around that word a lot. It's really hard to tell when it's actually like a disorder versus just normal life. Even just sadness is a normal part of life. So I'm going to list out a bunch of the different criteria for depression. And I think probably most people on this earth have felt all of this, one of them, many of them, but maybe just more on normal levels, like a day or two, or even a time that's really hard. When this becomes an actual disorder, it becomes something that's interfering with your life on a long-term basis. So basically, with all of these symptoms that I'm going to list out, it is considered a major depressive episode if it lasts for more than 2 weeks. That timeline is arbitrary. That's just something that clinicians picked to just, kind of mark to say that it's normal to feel sadness and depressed and down for certain periods of time. But if it lasts a long time, it doesn't really let up, it really gets in the way of your functioning in life, that's depression. So the first criteria is pretty much what you would guess: a depressed mood, feeling low mood, feeling sad, feeling down, not just for an hour or two, not just for a day, but for at least 2 weeks. And not only depressed mood, but not a lot of people know this one, but anhedonia, the feeling of just numbness, or feeling detached, feeling nothing at all, not excited, not engaged. That also is part of depressed mood too. So people just think of it as just sadness, but also could kind of feel that flat feeling, right? Where everything feels a little gray. Along with that comes a loss of interest and pleasure in things you normally enjoy. So if you find, this is kind of hard to tell in COVID, right? Because we actually are not really engaging in a lot of things that bring us a lot of pleasure and joy on a day-to-day basis. But if you feel like, you just really love to cook and you're not feeling up for it and you haven't been for a while, or TV shows or people or things that you used to at least get a little rush from or feeling some reward, it feels like you don't really want to do them and you don't really feel as happy and excited when you do them. So that's kind of lost interest and pleasure in things. If you're reducing your hobbies, you're withdrawing from social events, even if it's just, 1 or 2 meetings you have with a friend, that's a sign too. And along with that are all these different like health behaviors, right? There's loss of appetite or increased appetite. And really what that means is just changes in your normal baseline, right? If you find yourself really not that hungry, really not that excited about food, or you notice you're eating a lot more and have like significant changes in your weight, that's also a sign. Like depression is, we see this as an illness. So it affects not only the mind, but the rest of the body too. Along with that is problem sleeping. So that could look all sorts of different ways. It could look like sleeping more than your normal amount of sleep. It could look like having trouble getting to sleep, staying asleep, waking up early. That also contributes to the feeling tired and feeling kind of fatigued throughout the day. So just interruptions in sleep. One thing you could do is track like when has my sleep been, normal, like the normal hours I usually sleep? When did that start happening? And this one is a little, the psychomotor agitation and retardation. Basically, that means if you're moving or talking slower, or the opposite, feeling really agitated, feeling like you can't sit still and feeling restless. That is actually, those symptoms are usually found in like more severe cases. So a lot of people, when they have depression, they don't really identify with it, but they might notice that they're kind of feeling like they're working through molasses, kind of like just a little draggy, a little slower with the way they speak and do things. And fatigue, that's a big one. I mean, with Zoom fatigue, a lot of people have been feeling this, but it's this kind of a sustained low energy throughout the day. Again, around this time, not only isolation, but also like lack of sunlight, lack of stimulation, lack of being around other people. We all feel this kind of like, this fatigue feeling. But this is all, when it comes together with all these other symptoms, you can be like, this might be a problem. This just lasts longer than like a couple weeks. Not only does the body react to depression, but also just thoughts, the way you view yourself, the way you view your future, the way you view other people, your life. So a lot of people will feel a lot of guilt, a lot of low self-esteem, or feeling worthless. We'll talk a lot more about this, but depression can really affect how you engage in your life, how competent you feel, how much can you fulfill your normal responsibilities that that you're capable of and have been doing up until now. So, and then people feel guilty about that. They're like, I haven't really been doing work and being as productive or engaged with my kids as much as I normally am, and I feel really bad about that. I know it's my fault, or I think it's my fault, right? So this like guilt and low self-esteem and feeling like questioning your competence is a big part of it. Alongside with that is decreased concentration, right? It affects your mind. People have been noticing that they have a really hard time focusing, staying, even watching a movie. Sometimes it's like, I can't, I kind of tune out, or I'm talking to people and I'm tuning out there, having trouble making decisions that would have been easy. Like, what am I going to wear? What am I going to eat? Some people, when they feel depressed, those things feel a lot more effortful. Right? And then the last one is thoughts of death and suicide. Now with depression, I've heard a lot more of this, what we call passive suicidal ideation, which is like, what would it be like if I weren't here? Mm-hmm. I want this to end.
I can attest to that.
Yeah. It's just like, I feel like a burden along with that guilt. Like, what would it be like if I weren't here? But only some people will have the really thoughts of, here is how I would do it, and plans to do it. So any along those lines, thoughts of death in any form, it is part of depression too. But there are, varying levels of this. But so put those all together. It's, if your loved one is experiencing any of these, in order to really meet criteria, you need to meet at least 5 of these. So 5 of these symptoms that I just described all together in the same time for more than 2 weeks. That would be considered a major depressive disorder. But a lot of people have been feeling elements of these all the time in day-to-day life. So it's hard to draw the line on what's a clinical problem versus what life is like now. But just to validate that if your partner or loved one feels any of these things, then it might be a sign of depression. Even now, like I with this, with the Zoom world, like I love being around people. I miss my friends so much, and just this kind of this isolation is making me feel all of this. Like I just feel like, stuff I used to be excited about, I feel a little bit less excited about. It feels like a little bit more of an effort to drag myself to, cook or do things that I usually love to do. I feel really detached. So I'm feeling elements of this too, to be honest. And I'm sure, I know that, Jacqueline, you mentioned you felt depression before. You struggled with this before grad school.
Yeah, I'm sorry to hear that you're struggling with this now. I struggled with depression on and off for probably 8 years with 2 big peaks. And now, I have low times. But I went through such a shift after my last depression where I I firmly kind of let go of it. And so I kind of live now. For a while, I lived in fear of a depression returning, and I kind of organized my life around it not returning, which I think was good and bad. But yeah, I mean, I had a lot of adolescent depression. I went through a horrible year when I was 14. It was socially related, as probably adolescent depression tends to be. Just a lot of, I just remember feeling incredibly, incredibly bad and worthless and lost for a year, and so filled with, shame about who I was, and self-hatred, and it was self-harming, and it just writing dark adolescent poetry, and all that nastiness. And I feel particularly bad for adolescents because they don't have the kind of help that, I mean, a lot of adults don't have help either, but when your social group is a bunch of 13, 14-year-olds, you really don't have anyone who can helpfully understand you. They might be going through similar things, and then you wind up getting into co-rumination stuff, which isn't great. But I think, the more, the depression I remember most strongly was when I was 22, and I had this kind of three columns of my life shattered in quick succession. The first was I went through a breakup with my first love, and I lost a couple of friends. And then the second, I don't know if I should talk about this necessarily, but I had a fairly traumatic acid trip that just launched like months and months of anxiety and existential angst, and I became really obsessed with death. I started like envisioning 9/11 and like what it was like to be in that, and so I just had this sort of base level like anxiety that really shook me already, and so I think made me a little bit weaker and more vulnerable to what happened next, which was that I graduated college and took an internship in the career that I had been intending to go in, and it was so awful and humiliating, and I was so bad at it, and every day I woke up feeling incompetent, feeling like my boss thought I was worthless, because I think he did. I don't think this guy's a nice guy, and my depression was so filled with horror and fear. I don't know if that's super common or not. I would assume it probably is for a lot of people, but it was so filled with that because suddenly I didn't know where to go forward. And it felt like I was wearing 20-pound weights on me at all time. I mean, that fatigue like that you're talking about is just, I would find myself in social events. I love social events, and suddenly, it would just, I always felt like I was walking around with a smoke monster from Lost. I don't know if you've seen that, but it's just this huge like cloud of smoke that chases people until they're dead. And I just remember feeling like that was inside me, and every time I tried to find joy, the smoke monster would kind of come and overtake it all. And so, I was in social events, and all of a sudden the smoke monster would come, and I would just have to leave. I'd have to escape. I remember going to a vineyard, and with a couple of friends, and my friends were kind of going through depressions, and my best friend came in, and she was laughing really hard in the car, and I just remember looking at her and being like, I haven't felt joy in like 9 months. Like, I don't even remember what it's like to laugh convincingly. And so, it's just that constant state of nothing, no light is coming in. It just dogs you, and it's unrelenting. And finally, I remember sitting with that same friend. She was my best friend, Libby. There's Kibby and Libby. And I mean, this is why I went into psychology, because I was like, I'm not suicidal now, but every day when I'm sitting at that desk, I'm thinking, life isn't short. It's way too long. And it's so long, I don't know how I'm ever going to get through it. And I'm terrified now of work, terrified of career. And I know if I stay in this job, I'll kill myself. because I was thinking it all the time. You know, I didn't feel like it was eminently threatening because I was too scared, and I, you know, was terrified of death, especially after the acid trip. So like too scared to do anything about it. But it was the idea of death was a relief. The idea of just shortening the span where I had to cope with life was such a relief that I was like, I absolutely cannot stay in this. So that was depression for me.
Yeah. No, thank you that's such a beautiful description of what is, because, you know, I just listed out the criteria, and it can look so different based on each person, right? Like depressed mood, okay, but what does that look like for you? What shows up in your mind? How does that manifest? It is so different. And what's tough is like, I know how much you love social, like, connection and being with your friends and everything like that. You identify with it a lot. So I think the things that people love to do and do normal circumstances, they identify with that. They're like, oh, I'm the kind of person who's like really engaged. I feel a lot of joy. I laugh with my friends. And then when the smoke monster envelops you, it takes away like who you are in that moment, right? Over time, it's kind of like, and people around you might not even see why or really understand. Like you describe like this exquisite pain inside, but everyone on the outside might just be like, what's going on? Is something wrong? You know, it's harder to detect from the outside versus other kind of disorders, which is a lot more like visible and explosive.
Yeah, and I think the one thing that people were able to see was something that kind of irritated them, which was the constant rumination, because it was all I could think about, and it's all I could talk about. And I remember a friend being like, I cannot talk to you about this right now. Like, I cannot. Mm-hmm. Because, I mean, even, you know, when we did talk about it, it wasn't helpful. And I just remember everything feeling so complicated when I was depressed. Like, everything was webbed. I remember thinking, you know, just going through like, what is wrong with me? I would have these webs in my head. Everything would start with some stupid kind of thought about myself. You know, I'm bad at whatever. And then it would mean like, I'm bad at this because I'm inhibited. I'm inhibited because I'm worthless. I'm worthless because, and everything would interconnect. And there was something kind of addicting about the depression. I think because it kept me so self-focused. I was I was so trapped in myself and just looking at myself constantly and trying to go over and over and over again. Yeah, I was like trapped in a maze. And that, in a weird way, made me feel like I had depth.
But yeah. Even any intense, we always say that intense emotions love themselves. So when you feel angry, all you're doing is thinking of angry thoughts. Yeah. And when you're sad, it's like your mind is going to lock into the things that make you even more sad. And so it's just like all emotions kind of like quicksand, right? It's like if you get drawn more and more into it, and it's harder and harder to just step out. And it just narrows the mind. It just narrows the mind for like possibilities, creativity, openness to thinking of other things. And it's kind of what you're describing.
Yeah, well, and it was amazing because I felt like it was opening my mind. I guess that's the emotion loved itself, you know. It tricked itself into thinking that it was valuable and important, and it was what gave me depth. And then, you know, I was really into fiction writing at the time, and I was like, oh, all writers are depressed, so I feel like I have to use this time to write and write and write, but then it's impossible to write because you have such low motivation. And so, I don't know, it was just this endless loop.
Yeah, and I'm sure that it's hard for the people, for your loved ones, right? Because they probably know you as a certain person, and they probably were trying to pull you out of it in some way, and you're, you know, dragging into the quicksand, and they're trying to drag you back out, and they don't know how, right? And the more they pull, the more you probably pull back. So I'm sure it was a really difficult for everyone involved.
Well, it's not like it was fun for them to try either, you know. I mean, getting dinner with me wasn't fun. Going to the vineyard with me wasn't fun. It's just like, so I mean, it's hard. It's hard to help someone who is so blue, so down, so consumed. Yeah. And it just, you know, it keeps getting, they keep sinking in that quicksand, and you're trying to pull, but then every time you pull, there's kind of this reverse.
And again, I think that, you know, we kind of emphasize this each time in the podcast, but, you know, mental health is discussed in a very individual way. Like, you are sad, you are struggling with depression, but you could even see the the beginnings of how that would affect the your network around you and your whole, like, the way you engage with your friends and your whole life and your job and everything. It's a system wide process, and I'm really happy that Dr. Strauman is going to talk to us about that, and just to almost like situate depression in a context of a life and a context of relationships.
I am too. He's someone who is so full of life. He's so knowledgeable. Every time, I don't know, when he talks about these topics, they really come to life. And so I'm really excited to have him on the podcast. He's going to tell us about interventions to look for and how we can help our friends even when it feels totally helpless. Okay, so we are so very grateful to be joined by Dr. Tim Strauman. He is a clinical psychologist and professor in the Department of Psychology and Neuroscience at Duke University. He is an expert on depression and the way treatments for depression work. So thank you so much, Tim, for joining us.
Thank you for having me.
So we first just wanted to kind of ask you how you would define depression or how you would describe it.
Yeah, so imagine that you wake up one day and food doesn't taste good, jokes aren't funny. You see somebody you love and you care about, and it just doesn't really matter to you. You don't feel any spark. You don't care if you get out of bed or not. You don't care if you accomplish anything. You don't think anything good is going to happen that day. That's sort of what it feels like on a moment-to-moment basis to be depressed. And usually when I explain it to people, I try to explain it as your brain has sort of reset its thermostat at a level that's too low. So it isn't necessarily the case that anything is fundamentally wrong with your brain. It's that you've been experiencing a lot of stress and it wears you down and it makes you more and more skeptical that anything good is going to happen. And eventually you reach a point where your brain just shuts down and says no. And it's sort of almost like a protective response, but it has the effect of basically, nothing lights a fire. And you have no motivation, you have no interest, everything feels hopeless. You feel sad. So it's like a fundamental, the thermostat got reset at a level that's just way too low to be comfortable.
And for someone who's a loved one of someone with depression, how can they spot that? That just sounds like, I don't know, the case of the Mondays, or it sounds similar to like when people just, have a rough time and get sad. But how can you tell a depression? How could someone who's a loved one can tell a depression that's more serious from everyday fluctuations in that?
Yeah, I mean, it is something that all of us experience. We all do go through periods of time where it just doesn't feel that way. But if it's not stopping, and there's really nothing that somebody's responding to, nothing makes them laugh. Nothing is interesting. Everything is stressful. Everything induces guilt, and it won't go away. And it's day after day after day. That's when you're not just talking about something transient. You're really talking about something that's happened. That's a sort of a fundamental change of state in that person's brain, and something is going to have to happen to kind of reinstate the normal level of functioning.
So, kind of thinking about this description where nothing is working, nothing is funny, it's just trying everything and it's all falling flat. What should loved ones do to help someone with depression?
It's not easy. It's not easy because you start to feel very helpless and very frustrated because it seems like things that are really easy to do and that you're having to do every day, they're not doing. They're not able to do it. And no amount of sort of external pressure makes it better. So, we all remember what it was like to be a teenager and have a parent tell us, go back and make your bed, and, the struggles about that. And eventually we would capitulate and go back and make our bed and everything, and we'd go on. If you try that with somebody who's depressed, it just backfires. It makes them feel worse, and it makes you feel worse. You really have to think about it as right now, this person is not able to see that they actually can be effective on their own behalf. They just like they're literally their brain's not going to register it. Um, One way to think about that is that psychologists like me, we study lots of crazy things, and one of the things that we study is how do people persist in the face of failure, right? So you try something, doesn't work out. You try it again, it doesn't work out. And it's pretty remarkable that most of the time we can actually do that. And the reason we can do it is that there's literally a part of our brain that says, okay, I know even though the odds are against me, there's still a reasonable chance I'm going to be able to make this happen. And as long as that chance is there, that's all I need. That's all I need. So that's kind of how we do it. But when that number gets too low, when it gets below whatever the critical level is and gets close to zero, there's really no point in doing anything. It's like, why expend the energy? So it's almost like your brain is doing what it would be logical to do. Is I'm just, no matter how hard I try, I'm not going to accomplish what I want to accomplish. So there's no point in trying anymore. And then you get stuck at that level. So it's very difficult in the moment to interact with somebody like that. And what I will usually say is be loving, be caring, and avoid conflict at all costs. Avoid conflict at all costs. The best things you can do if you have a loved one or depressed are be non-judgmental and loving and get them help. Because you're not going to be able to help them and they're not going to be able to help them. But somebody who's a professional can come in, can change things, can help them sort of say, okay, we know what this is. This is depression. Millions of people have gone through it. We know how to get you out of it. We're going to get you out of it. And that takes the pressure off everybody. But, we all want to help so badly, and eventually you get to where you just want to grab them by the collar and shake them and say, what's wrong with you? Which, would not, of course, be a really helpful thing to do, but it would just be human nature to want to do that.
And it sounds like, I'm even just like gleaning from what you're saying, how frustrating and helpless it could feel as that loved one. Can you tell us a little bit more, either from, either patients, family members or friends who've talked about it, or from any other experience? Like what are unique challenges that people with loved ones with depression specifically can feel compared to someone who has a loved one with like substance abuse or, any other kind of mental health? What are the unique struggles here with depression?
If you're watching somebody with depression, they look the same to you. They're the same person. I mean, they haven't suddenly lost their ability to like function effectively in the world. Your opinion of them hasn't changed. You think they're capable of doing all the things they need to do. They just don't. So there's this big disconnect between what you expect them to be able to do and what you're confident they'll be able to do and what they think they can do at that moment. And that's where the frustration comes in. I've been on both sides of that. I've been through depressions. I've had family members go through depression, and the disconnect is just it's mind-boggling. To sit there in the middle of feeling depressed and just you're surrounded by people who love you. Come on, Dad. Come on, Tim. You can do this, and you just can't. And the more they say, "Come on," the worse you feel. And then being on the other side of it, it's like, come on, I know you can get out of bed. I know you can do this. And it's like, crap, I'm making it worse. I'm not making it better. It's such a change of state of mind for people that it's hard for somebody else to realize how profound that change is. Thankfully, it is reversible. We have lots of treatments that will reverse it. But until you've got that reversal process going, people are just stuck. And it's painful to be stuck, and it's painful to watch somebody you love be stuck.
It's interesting to think about that it's versus other kinds of disorders. Depression can be invisible to the outside, right? Like you're mentioning that it looks the same, that, your day-to-day life might not change a lot, but suddenly that person's assessment of their own capabilities or motivation or disconnection with the world is dimmer, is like a lower thermostat, and that might not be immediately obvious to people around them.
Yeah, that's a really good description. One of the examples I used to give in teaching, I don't give it anymore because you're not allowed to post people's grades, but you know how it would be. You'd be in an undergraduate course and there'd be a thing on the wall where they'd post all the student IDs and all the grades. And you'd watch two people who got the exact same grade, have completely different reactions to it, right? So, Kibby, you look at it and you've got a 97 and you're devastated. Oh my gosh, how could I have missed those other 3 points? What's wrong with
That
me?
does sound like Kibby.
Yeah, that does sound like, yeah, that's why I said that.
Why did
I see I have a
I'd be doing
97
cartwheels.
and I'm like, you got to be kidding me. I didn't even study for this thing. I'm the luckiest person on the face of the earth. So, that's transient, right? And that happens to all of us. And so, there are some things we're more pessimistic about and some things we're more optimistic about. But imagine if no matter what feedback you got, your reaction to it was, I failed, right? It becomes very cumulative after a while. And, the negativity feeds on itself and your body is shutting down, your mood is awful, you have no energy, you watch yourself not having energy, lying in bed. I heard a really good description the other day, and I can't remember the name of the poet, but what he said was the most excruciating part of his depression was he'd be laying in bed and the bottle of antidepressants was just out of the reach of his hand. And he couldn't get himself to muster the energy to lean a little further and open the bottle and take his antidepressant. Just remember thinking, God bless. I mean, imagine what that feels like. And that is what it feels like.
So I was listening to you talk about how how we can help our friends and family, and you said a couple of things like avoid conflict, and that saying things like, I know you can do it, get up and do it, is maybe going to backfire or just make you more frustrated than it's worth. What are things that people often do that are unhelpful? One of the things I'm thinking of is I know like co-rumination can be bad for women specifically, I thought. So I know when I was going through depression, I always wanted to talk about it and talk and talk and talk. And there was nothing anybody else could say that would actually make me feel better. So I've always kind of wondered, like, what is the role of talking with friends? Or I remember also just everything was suddenly so complicated. Like, I remember creating this web of what was wrong with me, and it's all started from I'm a bad dancer. And that fact just became this immensely complicated. No. And then later, when that depression ended, I was like, what was I even thinking? Like, what? Nothing is complicated at all. So I'm kind of wondering, like, how do we interact with people who are depressed, or our loved ones that are depressed, and what kind of things should we avoid?
Yeah, that's a really good example. So, lots of us ruminate on a good day, and there's a sort of a defensive quality to it. Like, if we tell ourselves in advance that we know we're not going to do really well on the test, then if we don't do really well on the test, we think we've kind of inoculated ourselves to it, right? And it's sort of a habit that a lot of people have. But if you're somebody who ruminates anyway, and then you get depressed, it becomes this never-ending cycle, and it just feeds on itself. And it's not easy for friends to not get pulled into that, because the natural tendency is to say, oh no, Jacqueline, that's not true at all. You're a terrific dancer and you're a wonderful human being. And at that moment, nothing they say is going to change the rumination, because your brain has already gotten set at a lower level, and all of your energy is going into obsessing about all the terrible things that are happening. And in a situation like that, you want to guide the person away from the rumination as many times as it takes, and just keep it really simple. Look, we know what's happening here. This is not you. You're depressed. This is a state that your brain is in. You didn't cause it. It's not a reflection on what kind of a person you are. When this is over, you're not going to be thinking any of these things. But it's really important right now that we don't, that we keep you from focusing any more on it than you're already going to be focused on it. You just keep coming back to that. We know what's happening. We know what to do about it. I'm here for you. We're going to get you help. We're going to get you through it one step at a time. And we have to make sure we don't get caught in this sort of rumination cycle that just gets worse and worse.
I wish I could. I'm going to write that down.
Seriously,
that was such a nice script. That was just so beautifully said. I'm like, oh, thank you. So thank you. I appreciate that. It's always nice to actually get some words. People can frame it in their own way. But with all this feeling of helplessness of like, even just feeling like, oh, if I encourage them, if I make them put on their shoes and take them out for a walk, that's helpful. But it's nice to know that, these words of saying like, I understand that this is depression, it's not you, and here's some love and support for you, and let's get you help.
Yeah. There has to be a balance, right? Sometimes you just have to set limits, and you just have to say, look, you're driving yourself crazy here. You're not yourself right now. Let's not do this. Let's find something else, that will not make you feel bad. When they get engaged in treatment, and they need a helping hand, and they need somebody to say, hey, let's go for a walk. Then you as a loved one can become part of that process. And that's when, you can feel more active. But usually up front, it's just help people put a lid on the ruminating and just keep saying, we know what this is. This is not you. Your brain is going to be pushing you in a direction that's going to make everything look negative, and you're going to feel terrible, and you're going to feel like you let everybody down. That is not what's happening. That's a symptom of a state you're in. That is not who you are as a person. And we both know that. And we're going to get you back to being the person you really are.
It's interesting hearing your description of depression, all the different examples that we've all been talking about. A theme is not being able to reach your goals. Like you mentioned failure earlier, or like feeling like a failure, or your perception on your own abilities to like reach for that bottle of antidepressants, or to do something, right? Can you tell us a little bit about depression from the lens of goal setting, regulation, things like that you're so
sure.
knowledgeable about?
Yeah. So one of the things we've known for a long time, and I think that this even goes back to Freud, is that, we all have standards that we live by. We all have a sense of what kind of person do we really want to be, like to be the best we could possibly be, what kind of person we're supposed to be, from a sort of a ethical and moral standpoint. And, thankfully, we're all very attuned to times when we're meeting those standards and times when we're not. Right. So that's really adaptive. Like you, as a person, you want to know, oh my gosh, there was something that I was supposed to have done. I didn't do it. And I feel bad about it. And feeling bad about it motivates me to go back and fix it and to remember next time. You're trying to sort of say, I want to bring my GPA up to a certain level. And, I've brought it up a little bit, but I'm not there yet. But it gives me some energy. So we know a lot about how motivation works. And, there's kind of two kinds of motivation that people have, is approach and avoidance. You're trying to make something good happen, or you're trying to keep something bad from happening. Depression is a failure in the system where you're trying to make something good happen. Because you think, hey, the probability of something good happening is now 0, and I'm just not going to make it happen. That creates two problems. One is you lose all the positive emotions that you get from seeing yourself make progress, right? I mean, you just lose all that, and that's very reinforcing, and it's like it's gone. And the other thing is there's only one kind of motivation left, and that's the motivation to keep bad things from happening, and that's not enough to sustain us, especially when we start thinking of our whole world as that way. Everything is just a chance and another opportunity for Tim to screw up. Right? That's kind of what the rumination often turns out to be in depression. And, I'm just not meeting this standard, not meeting that standard. So we actually developed a therapy for depression that really focuses on this process. And the idea wasn't that it was going to be like, the best thing for everybody. It was that there were some people for whom this was really kind of the big dynamic in what got them to be depressed in the first place. And, it's not rocket science. We help people learn, what are these standards that you have for yourself? Where did they come from? A lot of us, we have standards from when we were a kid, or, things that were important to our parents when we were growing up, or important to a spouse, or, and every now and then it's a good thing to sort of say, maybe that one's not working for me anymore, or maybe it's unattainable, or maybe I can focus on a different one. So part of what we try to do is just help people learn that process is always going on, always going on. I mean, we can't not do it. It's that fundamental. I'll often use the example of, like, if I show you the letters C-A-T, you can't not see the word cat. There's no way to do it. It is so overlearned and so over-rehearsed. Well, all of these things that we do to evaluate ourselves and control our emotions, we can't not do them. They're happening automatically. The only thing we can do is become aware of them and decide how we want to fine-tune them. So we help people become aware of the standards, and we help people sort of make choices about, are these really the things that at this moment in my life is going to be sort of get me to where I want to go? And if they are, then let's look and see why it's not working, and what can we do differently. And the mantra is, what are your goals? What are you doing to try to attain them? Why is it not working? What can you do differently? Right? So basically, your grandmother or my grandmother could have dreamed this up. They just didn't. So.
And that actually gives a little insight. I was just thinking about how that would make even the interaction with a loved one be so challenging if the loved one says, hey, come on, get out of bed, do this thing that you know how to do awesomely. And that could sound encouraging, but it might signal to that person, like, this is the standard that you or someone set for you, and you don't feel like you could reach it today. But that person's like, do it, be the standard, be good enough, be this person.
Yeah, we did a clinical trial using this therapy in older adults with chronic pain, and the typical story of these folks was, it was somebody who'd been in their job for a long time, got injured, couldn't work anymore. We're used to being a breadwinner, we're used to being a provider, we're used to doing all the things that they did, and they couldn't do it, and just felt terrible. And no matter how much their family said, we love you anyway, they had this set of, no, this is me. This is how I get to feel good about myself as a person because I'm doing those things. And, all we did was really come along and say, okay, there are probably some things you're not going to continue to be able to do, but I bet there are a whole bunch of other things that would also be satisfying. And I bet if you talked with your family about it, they'd say, that's great. I don't need you to be the breadwinner. I need you to be this, and just sort of get that negotiation started. Yeah, there's a lot of how we interact with our loved ones that signals what our standards are for them. I used to think when my kids were growing up that I was this very, approach-oriented dad, and hey, reward and all of that, and my kids still laugh at me. They're like, no, Dad, you were all about don't screw up. And I was like, I don't remember ever saying that. You didn't have to say it. That was your view of the world. Don't get in trouble. Don't screw up. I was like, oh, I screwed up. But so a lot of what can be helpful in this therapy is just for you to understand that you're just used to seeing that. That's how we evaluate ourselves. I mean, we're primates. We got to keep ourselves alive. We have to keep ourselves connected to the other people around us. And you can think of it as sort of going even back to attachment theory, right? What do we need? We need nurturance, and we need security. How do we get nurturance? We connect. We do things that make people love us. How do we get security? We don't screw up. So these are very old themes, and they certainly didn't originate with me. We're just sort of trying to make them salient. We also, in this therapy, we borrowed shamelessly from all the other good therapies. And one of the things we borrowed is from interpersonal therapy for depression, which has this feature basically where you say to people, it's called the sick role, which I don't really like the label of, but you're basically just saying to people, look, you're just not 100%. If you had just had a heart attack, you'd be cutting yourself some slack, right? You're depressed. You're also entitled to cut yourself some slack. You will get back to being 100%. But the quickest way you're going to get there is to say, okay, for the time being, I'm just not myself. I'm not functioning on all cylinders. And that's okay for right now. And that's an important part of what any good therapy for depression does, is sort of help people say, I'll get there, but I've got to cut myself slack so that I have the opportunity to sort of ramp up.
Okay, so if you are listening to this podcast right now and your spouse is depressed, and we're hearing all about this intervention, behavioral activation, would you take any cues from this treatment? Like, I loved what you said about we sort of implicitly set the standard for other people's behavior. We kind of show our expectations for them. Could you lower your expectations, break break activities into tiny little parts, help your partner achieve little sort of bite-sized improvements, or would you just scrap all of that and just get them into therapy and just focus on avoiding conflict? Like, is there anything friends and family can take from the treatment, or would you just say don't go there?
Well, I think you always want to help people get help.
Mm-hmm.
Um, one of the really powerful things about treatments for depression, whether they're medication or therapy, is people get kind of remoralized. They get a sense of, all right, there's a name for this. I'm not the first person in the world to have to deal with this. There, maybe there's hope, right? And it's just a little, maybe there's hope, but maybe there's hope is very different from where their thermostat has been, and it's really an important move in the right direction. So I think that's big. People learning to manage their own expectations. I mean, it's not easy to live around a person who's depressed. I mean, it's really hard. It's painful and it's frustrating. And, that's all going to leak out. And the only way you can deal with it is to keep, telling yourself while you're telling your partner or your loved one, we know what this is. It's temporary. It's not going to last forever. We have to adjust our expectations for the time being, but we will get back to where we want to be. And the best thing we can do is try to be patient with it. And yeah, somebody else is going to have to pick up the slack. But that actually is the fastest way to get there.
We've always started to talk about treatments, and if a loved one is searching for good evidence-based treatment of depression, we've been talking about different kinds, but can you list a couple ones that you're like, if you were to look on Psychology Today or Google, what kind of treatments for depression would you say you would, steer loved ones towards?
Yeah. I'll just sort of speak about antidepressant medication briefly. I mean, there are a whole bunch of effective antidepressants. We don't have the ability to predict in advance which one is going to be optimal for an individual person. So if you go that route, it takes often some patience to sort of find exactly the right one at exactly the right dose. But they are effective. They have relatively low side effects. They're safe, and that technology's come a long way. I would never hesitate to recommend to a friend or a loved one to get a medication consult if they're depressed. I would never hesitate to do that. On the psychotherapy side, I think there are 4 therapies that really stand out that have, strong evidence bases, and they just agree with people. The sort of people get it. The first one is cognitive behavioral therapy, which is sort of the gold standard for treatments of depression. And that really focuses on when you're depressed, it changes how you think about yourself, and it makes you evaluate yourself negatively, and it makes you be hopeless. And people learn a set of skills to catch that as it's happening and interrupt it. And then ultimately what happens is they start to be able to prevent it from happening, and that facilitates getting out of the depressive episode. So there are reams of data on CBT, and there are lots of different variations on it, but they're all basically operate that way. The second one, which I just mentioned briefly, is interpersonal therapy for depression, which is a really robust collection of things that we know work for people in their day-to-day relationships once they've gotten depressed. And it's a brilliant therapy. It's beautiful. You sort of just sit down with the person and say, okay, how are we going to make sense of this? Is this grief? Is this, something, about you that you need to learn some new skills to cope? Is it a role transition that, you didn't anticipate, like you just got fired? Is this a conflict in your relationship? What is it? And you sort of pick one of those four things and you just go with it. And it's really remarkable. It's not as well known as it should be. The third one is behavioral activation, which, has sort of come on the scene recently and is enormously effective. And really what you try to do is focus in on from the bottom up. Let's get your body and your brain reactivated and slowly get that thermostat reset. And it ends up sort of feeding out into how people think about themselves. And the fourth one is acceptance and commitment therapy, ACT, which is a really nice amalgam and synthesis of a lot of the earlier therapies. And any of those I would definitely have confidence in.
Yeah, what is the name of yours?
Self-system therapy. I really believe in it. I think it's very effective. We've got lots of good feedback on it. It's been wonderful working with patients, sort of for them to help us do this. Right now we have a trial that we've just begun working with people with end-stage lung cancer. And it has been enormously gratifying to work with these folks. It's like, even at that point in their lives, they still want to go through the process of saying, my life is still meaningful. There are still things that matter to me, and I get to choose. It's really humbling. I got to tell you, it's an experience that we did not anticipate. And we're actually now moving into working with Alzheimer's caregivers to try to do the same sort of thing. It hasn't really been disseminated yet, so it's not something that you could sort of walk down the street and find somebody doing, but that'll happen someday.
I just love how even just all your descriptions of what depression is and the different treatments, a lot of it is, you think of depression as just being really sad, but what's emerging from these conversations is how much of it is like your perception of your role in society. What is your purpose? What can you do? What can you not do? And how, and then you have these people around you who are gotten used to that, expect that, identify with you in a certain way. And it's really hard when that person on the inside, suddenly something changes in the way they see all those things. So.
Yeah. It's remarkable to think about, if you've ever been through depression and just sort of look back and say, what that felt like and how you normally feel when you get out of bed, how you feel when you get out of bed on a bad day. A bad day is nothing compared to that. And it's a sort of a real testimony to how our brains really do determine so much of what our experiences are. But yet we know with these therapies that we can undo the damage. We can reset things. It's really remarkable. And it's the thing that got me interested in psychology in the first place a very long time ago was, what's the relationship between the mind and the body? People used to talk about psychosomatic illnesses and all of that. And that was sort of what intrigued me. And then I sort of shifted over to depression. It's like, what is this thing where one day you see yourself as basically a decent human being and the next day you see yourself as worthless? And it turns out that's really not a change in the structure of your brain. It's a resetting. You can see differences in the brain, but then there are things you can do to undo it. And a lot of those things are behaviors and thoughts and have nothing directly to do with biology. It's just fascinating.
Well, thank you, Tim, so much. This is something that I used to struggle with a lot, and I feel like I've learned so much just in the past half hour of talking to you about something that I even experienced myself. And I just remember I have no idea how people would have helped me back then. So this has been enormously informative and helpful. And thanks so much for coming on.
Oh, you're welcome. Thanks for having me. I really enjoyed the chance just to talk about what my experiences have been.
Thank you.
We'll close out here, but depression is such a big topic. It affects so many of us. We are certainly going to do more episodes. So if you have any questions, any comments, please reach out to me. Let me know. Let me know what kind of other facets of the disorder you'd like to hear more about. Perhaps we could talk about recovery, so let us know what you want to know. And you can contact me again at Trombolina on Instagram. Please rate, review, and subscribe if you enjoyed this episode or any of our episodes. And Kibby will close us out with some resources.
Yeah, we'll add a couple of resources on the website, especially what Tim was talking about. But a really good starting point. One of my supervisors recommended this book, and I really like it. It's called Feeling Good: The New Mood Therapy by David Burns. It's a good starter to really it's a very accessible book to understanding depression, at least for yourself, and you could apply it to thinking about your loved one. So I'll start there, and we'll offer more. And yeah, please let us know. This has been a great episode. I really appreciate you sharing your personal experience, Jacqueline. It was really great and really illuminating.
Well, thank you, and thank you all for listening. We'll see you next week. Bye. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.